Good morning. It's now 7:15 on this 26th day of March 2019. Welcome to Daybreak News Review to talk about what's happening on the dailies. But I begin by introducing our panel. From this side, Sabina Shege from Murang'a County. Karibu sana. Gladys Wanga from Homa Bay. Gladys Boshole from Uasin Gishu, and Chris Wamalwa, a Member of Parliament for Kiminini constituency. Karibu sana. My name is Sam Kitukonyo.
And my name is Zinzi Kibiku. As always, we'll take a look at some of the stories making headlines in the local dailies. But today we want to take a different twist. It's one of the stories that we aired at the very beginning of the bulletin. And we just want to begin with that, where a Nairobi businessman has offered to pay about 250,000 Kenyan shillings for more than 20 women with birth-related complications who are being held at Kenya's largest referral hospital for failing to clear the medical bills.
The businessman Philip Arunga made the commitment after Citizen TV aired the plight of women, some who have been detained at Kenya's National Hospital for close to a year. The hospital, however, denies claims of detaining the women, as Purity Mwambia now reports.
We are sneaking into Kenyatta National Hospital, armed with our cameras. We gained access to the heavily secured Kenyatta National Hospital and filmed secretly. These are the scenes that confronted us inside Kenya's largest hospital. Women lying down, others sitting on the floor. Some have been here for the last 2 months, others for as long as a whole year. They're being detained against their wish, and the reason, they're unable to pay their hospital bills. These 20 women are suffering from birth-related complications, and some of them have been separated from their newborn babies. Susan Jane Wanjiru delivered her baby at Nairobi's Pumwani Maternity Hospital, but developed complications thereafter.
Nikatengenezwa halafu nikaleta kwa hii room, nikaambia kadi yangu haiwezi nisaidia kwa saa hii ya mzee. Alafu sasa hiyo bili yao ni kubwa. Tumelemewa.
Bili imefika pesa ngapi?
53 hapa kulala ni 1200.
She has had to give away her baby to Good Samaritans.
Amka kabisa uone hawa watu.
We traced the baby in Embakasi.
Nimekuwa na yeye na mfeed maziwa. Na Mungu ni mwema, amekuwa tu mzuri. Hajakuwa na tatizo. Siwezi enda kazi, siwezi enda mbali. Like sasa kama ni duka ni kwenda tu mbio, lakini bio hapa siwezi enda mahali.
Then there is 70-year-old Mamuri Kikaka, who hails from Madhima area of Kitui County. She has long been forgotten, and she has lost hope of ever returning home. Then there is Taka, who has been here for the past 2 months.
Nilikuja hapa, nilikuwa namwagika damu mingi sana. Placenta nilikuwa imebaki ndani ya tumbo. Wenye walinitoa placenta, wakaniwekea maji, wakuja wakanitoa damu, wakasema wanaenda kunitafutia damu yangu. Misho yako hawakuniwekelea damu nyingine. Walinitoa kwa wodi kama niko na 0.5.3 ya damu, wakanisukumanga huko. Alafu ukigonjeka ukienda huko kuomba dawa, wanakuambia dawa si njugu, ambia watu wako wakubaishie dawa kuletee. Alafu siku nyingine kaenda kuulizia bili yangu. Walinifukuza kama mbwa, akaniambia ambia mtu wako akuja kuangalia bili, ni mimi sina mtu.
Evangeli has also been here for the last 3 months.
Sasa nimedaiwa 28k. Mimi sina wazazi. Niko na nyanya yangu na hana uwezo ya kulipa hiyo pesa.
Most of the women detained at the hospital do not have the NHIF cover, while others were referred here after developing complications during delivery in other hospitals.
Tunateseka. Kunguni ziko hapa ndani zinatuuma sana. Matandiko hawezi kuwapea. Hata ichafuka wanawaambia mvumilie, nyinyi muambie watu wenyu walipe bili muende.
But the hospital denies claims of detaining women.
There are no patients retained at the hospitals because of non-payment of their bills.
They came in to seek healing from illnesses, and now they lie hopeless, waiting for just one thing: freedom from the hospital. Purity Mwambia, Citizen TV.
Mheshimiwa Sabina Shega, you're the chair of the health committee, and you look at these images and the voices of those mothers, separation from a mother separated from the child and what they have to go through. And the PS says that there are no patients detained. What does this mean?
Let me just make it clear that the PS was responding to a question that had been raised in Parliament earlier. And she appeared last week on Thursday before my committee. And the question was on how many patients have been detained in both public and private hospitals. And also the bodies are being retained in the morgues. And so when she answered, and she gave the answer that there are no patients who have been detained in public, she started with the public, the referral hospitals. And said for the private hospital, they want to send a specific body to go and find out. I told her, one, that was not the right answer, because we were in Kenyatta Hospital on Wednesday, actually. We spent the entire day there. But secondly, we all know, if anyone of you who is a member of parliament, in our phones we don't have less than 10 people who text you almost on a daily basis that they are either detained in hospital or their bodies are being detained. And I actually on the same day cited to her that there was a case in my county that a body has been retained in KNH, Kenyatta National Hospital, for 4 months. So just to summarize what is happening at Kenyatta National Hospital, one, we don't have leadership. I think the fact that we disbanded the earlier board took some time and appointed a chair whose tenure expired on Sunday last week, so they don't have a chair. Currently, they have been having a CEO who has acted for 1 year, more than a year now. And I think somebody went to court when they advertised for the position of the CEO. So there are gaps in leadership at Kenyatta National Hospital. We were there, we met with the staff members. Actually, it's very sad that the staff members told us some of those women who are detained there for a long time, either because of their bills or the children, sometimes they also end up getting pregnant in the hospital, because they are also, and especially for ones who have children at the ward, if a father is staying with the child and a lady is staying with her child, so they end up even having a relationship, because there is no ward for the mothers and the fathers who come to stay with their children, and they are forced to stay in one area, common room. And so what happens is after either discharge, then the fathers come to complain to the hospital that my wife came here, stayed for 3 months, she has come back home pregnant. So it's a very sad affair. We have visited all the referral hospitals, because the main concern about our committee was that yes, health is devolved, but we need to see our referral facilities first taken care of, even before the government going to the counties to start giving them equipment and other things. You cannot leave your child starving and you go to start feeding your neighbor's child. And so we started, we have gone to the spinal injury hospital, we have gone to Mathare, which is also a very sad case. We have gone to Moi Teaching Referral Hospital, and now on Wednesday we went to Kenyatta. We didn't even go around because we took the entire day from 10 to 8:30 in the night.
So
when we were doing the meeting.
As soon as perhaps you get to hear of these cases,
yes,
how soon, how fast does the response process happen? How soon do you act? And perhaps what is the committee doing to make sure that tomorrow, next week, next year, we're not at the same place?
Well, we are tabling a report in Parliament. You know our role is oversight. And of course, then we wanted to be thorough and advise Parliament. And I know Parliament, they're going to endorse our report on the recommendations on how to handle our national facilities. But at the same time, we sent the PS to come back with an answer this week on Thursday. And we're expecting her to come back, because basically even the kind of answers that she brought and said there's none, I actually told her if I were you, I would have fired the officers who wrote for you that answer and who actually even accompanied her there. But I think we have lacked ownership. There are leadership gaps, and I think people should start taking responsibility. It is a high time that if you have given an opportunity, whether you are Director of Medical Services, whether you are CEO, whether you are the head of that department, I think people should be shown the door. People should go home. Because I think the whole thing and how we are suffering as a nation, even with this whole story about corruption, It's about just saying there's a problem, and action is not being taken.
Yeah.
And I think we have had issues with Kenyatta for a very long time.
Honorable Gladys Wanga, when you see this story, what does this say about the Kenyan government's commitment to make sure that affordable healthcare is given to every citizen, that we're also playing our part when it comes to achieving universal healthcare?
Yeah. I think the case of KNH flies right in the face of the universal healthcare agenda. And I just want to take on, Chair of Health. I think as you say that the PS came to you, the PS who is 2 weeks old cannot be allowed to come to the committee when we have a cabinet secretary. The cabinet secretary has been there for all this time. Why didn't the cabinet secretary be the one to come and answer questions, knowing very well that her PS is 2 weeks old? The issue of Kenyatta National Hospital not having leadership, I think this back lies at the door of the cabinet secretary. We need to hear what the cabinet secretary is saying about Kenyatta National Hospital and about the leadership issues at Kenyatta National Hospital. This issue has come to the floor of the House, and Honorable Sabina knows that even the cabinet secretary was being indicted for the failures of KNH because we've had, whether it was the patient being killed, whether it was children being stolen and die. We've had case after case after case. And at the end of the day, the cabinet secretary stays away. You have a principal secretary who's 2 weeks old, is thrown into the committee to go and answer questions for which she has no... So you see her making a fool of herself, not because she wants, but because she is so new and she's just responding from bits and pieces. I want to put this back at the door of the cabinet secretary for health. Are we committed to achieving universal health care as a country? Are we committed with the kind of things that we are seeing? We need the cabinet secretary speaking to this issue. In fact, I would tell the chair of health committee that the next answer you're getting should not be from the principal secretary, who is only 2 weeks old. You should demand that the cabinet secretary appears with all the officers that we're talking about here, the DMS, the CEO of KNH, the whole team should be there, so that we are not having the kind of situation we are having with the ministry, making a fool of themselves. It is obvious what is happening.
Actually, the cabinet secretary is one who was supposed to appear, just to answer to Wanga. And the reason we were told why she didn't appear was because her counterpart from Thailand was here and they were signing a memorandum. So she was hosting the cabinet secretary from Thailand, and at the same time then the PS had to come in, and the CAS had gone to Cuba, what is also happening in Cuba. So I think it's a ministry that is in a mess. And another question we asked, where was the DMS? We have been asking as a committee, every time that we call the ministry, we don't see the DMS at all. And then we were told the DMS was in Dubai.
Wow.
That's
a traveling ministry.
Yeah. Yes, I think I'm glad that we have the chair for health here, Sabina Chege. Because I think you have to look at the models of other hospitals. Why is it that other referral hospitals are working? Why is it that KNH has a problem? So I think at the end of the day, you have to ask yourself, who is the CEO and the board of management at KNH? Because that's where they're failing. Long before you get to the PS or the CS, who will be dealing at a policy level. But day-to-day operations, like whether the patients are being held, whether bills are being paid, that is something to do with operational management that must be dealt with. So definitely, the CEO has failed in their job. Because if you use the example of Moi Teaching and Referral Hospital in Uasin Gishu County, it serves 19 counties, the surrounding counties. Yet you do not have that problem at all there. Actually, Dr. Arwasa should be used as an example of a good CEO who's managing a hospital. They have social workers within there. They're able to tell you. In fact, I remember the times I've visited there, immediately you get to his office, he will give you a list and tell you, these are needy cases that we realized, even if we kept them, they're not going to be able to pay the bill, we have discharged them. But anyone who's willing to help us pay these bills, we will, and we're working on a program with him. He will be able to tell you that, and the social workers are able to advise them that this person will not be able to raise the money. So why doesn't KNH have a similar program? Because the longer you keep them, as a CEO, you have to tell yourself, the longer you keep people, it still costs you money to keep them. So all you're doing is incurring more costs, and so on. So I think it's a management issue.
Actually, they showed that
clip. Is saying, yes, about that the PS is 2 weeks old. That's not an excuse at all. In fact, the first thing you do when you get into a job is to get a brief. The handing of a brief should have had those notes.
Okay, I want us to focus on the bigger picture here, because you remember there was the free maternal
Linda
care.
Mama.
Yes, Linda Mama.
Yes.
We have Susan Jerry saying that she has a bill of 53,000 shillings. Now, the child has had to be taken by a well-wisher. And then you see the kind of facilities that they're having to use, sleeping on the floor. Some of them complain that they don't have the bedding that they require. What does this mean in as far as we talk about free maternity services, yet we have situations like this? What need we do to ensure that we do not still focus on such kind of situations?
I think the issue here is about budget. When you look at Kenyatta National Hospital, it's actually the biggest hospital in the country. And I keep on going back to the budget policy statements that we just passed in Parliament, and particularly on the Jubilee's manifesto of universal healthcare. When you talk about universal healthcare under the Big Four agenda, it must be followed. The government must show serious commitment in terms of allocation of funds for the aspects of universal healthcare to be successful. But when you look at the budget policy statement, the way it came in Parliament, there's a total disconnect. And going back to Kenyatta National Hospital, the backstops are the CEO. And the CEO, been told, has been acting for 1 year. Whether he's been acting or not, but the backstops at him. And in this case, the matter of women not being detained or whatever, that one is a day-to-day operation. It has even nothing to do with the board whatsoever. This is a responsibility of the CEO. And when somebody has been summoned in Parliament, whether it's a PS or a CS, they'll get information from the CEO. So in this case, to me, by the way, the PS being there for 2 weeks or whatever, even if it's 1 day, it doesn't hold water. You are supposed to be given a brief, and in such a case, you go with the CEO. That cannot be an excuse. So in this case, I know Madam PS, currently the PS who is there, she's very thorough in her job, but that does not mean when she's there for 2 weeks, she'll be allowed to give excuses. And again, if they've been summoned the CS should be there, the PS or the CAS. But in this context, the key person is the CEO. Remember, last year, Lily Koros, she was kicked out of leadership because such incident happened, okay? But the CS was spared, and they left questions asking, is there someone protecting the CS? There's also a responsibility that the CS has to be held responsible. Now we've come to the new CEO. We are seeing already the same mistakes that were there. So I think when it comes to KNH and the entire healthcare sector, it needs a thorough radical surgery. But in this case, as I conclude, Kenyatta National Hospital, I had a patient about 2 weeks ago. He had an operation, and he was told you can't go to theater unless you give some deposit of 20,000, which I gave. When you look at these CEOs, they also have a performance management appraisal, whereby debt management, debt collection, credit management is one actually of the indicators in terms of their performance. Because they are saying if the funds are not given, the hospital will not run. Maybe we should revisit this matter and see our key national hospitals, how we should fund them. But in Parliament, we passed a motion that no patient should be detained for failure of paying. So maybe when it comes to the issues of implementation, and this is where our EPO chair maybe should be able to shed more light. But he should not come and tell us that the CS was away signing a memorandum with the Thailand. No.
So who should be held accountable?
In this case, the person will be accountable. First is the CEO of Kenyatta National Hospital.
And I just want to intervene by saying the reason, because it has been challenged why I'm bringing the CS into this matter. And you guys will agree with me that KNH is the largest national referral hospital in this country. KNH has been in the limelight for all the wrong reasons. From day one up to, where we are now. Over the last 2-3 years, it's been the wrong reason. The one CEO left after another. There are the leadership issues that have been explained by the chair of the health committee. When you have a situation like that, you expect the person responsible for that docket to take charge. It's not an isolated incident. If it was an isolated incident of women being detained, then you'd say, what is the CEO doing about it? But then you have incident after incident, which would require the CS saying, these are the measures we have taken to make sure KNH as a national referral hospital is on the right path. If the CEO is not functioning, the CS should be in a position to sort out this issue. And for me, The buck stops at the door.
Allow me to shed some light here, because you touched
just
on...
before you do, Chair,
Yes.
I want to refer you to, in October last year, Lady Justice Wilfreda Okwani ruled that it is a violation of patients' rights when hospitals refuse to release them over accrued medical bills. And she said that, yes, the hospital has the right to demand payment. So where do we go from here? There's a motion that he talks about that Parliament said patients should not be detained, but they are being detained. Hospitals need this money because they have to pay bills.
Yes.
So how do you help them out?
I think one of the things that I want to talk about, one, it's even a constitutional right to access to health in Kenya. That is one thing that we must appreciate. And I wanted to pick up from the issue of what you asked about Linda Mama. Because we're also working on a paper about NHIF reforms. Linda Mama takes care of the pregnant woman until she gives birth. And immediately after, they don't even take care of the baby. So if somebody gets a baby in Pumwani Hospital, then you are referred to Kenyatta National Hospital when there's a complication. Then Linda Mama does not take care immediately after. And that is a problem that you saw somebody stealing a baby from Kenyatta National Hospital. And that is one of the big questions we have been asking NHIF. Why do you want to cover until the child is born? Right. Then after that, we know as women, immunizations happen up to 9 months to 1 year. So that is what Linda Mama should take care of. But immediately after, they assume that you must have or should have an NHIF card, and then NHIF will cover for you. But if all these women you have seen here, the majority of them have no NHIF cards. And so Linda Mama takes care up to that level when the baby has been delivered. The second problem we have, even when we spoke with the leadership of the Kenyatta National Hospital, many people, heads of department, told us, I am a very good doctor. I don't know why I was appointed to head a department. I am not a manager. I am not trained. I don't want this job. And I think that has been also a problem.
Do you think managers should not be doctors? They
are the ones who said, you see, if I am a very good surgeon, and then you give me a head of a specific department, and I have no management skills, I'm not even interested. I am so much interested in my training. Remember, Kenyatta is a training facility. They also have students that they teach. So, and we actually asked the board members, how is the leadership picked? They are the ones who said, and I think once we table this report, it's going to expose a lot of things. Mheshimiwa here talked about the budget. It is not about the budget. There's a lot of money that has been put even in universal health coverage. But where is the money going? That is the biggest question. We have also had a problem, even when we're looking at the BPS, the ministry itself was not ready. They were not even sure on what has been covered in the BPS. Including the PS, we spend almost up to 1 a.m. with my committee. But the health budget would come from them. Exactly, but they seemed, even the PS, the former PS who was there before said, the officers went to Treasury, they didn't seem to know what was in their own statement. And you know, the ministry also, and this is something we are fighting, has become a procurement entity. Instead of looking at the things that will benefit the patients, they are looking at the things that they will be able to buy equipment and other things. And so what I would like to respond is that we have thoroughly, Mheshimiwa has talked about MTRH. Even if you look at my clip on last week on Wednesday, when I was at Kenyatta, almost at 7 p.m., I told them, you don't need to go benchmark anywhere else. Go to Moi Teaching and Referral Hospital. The management is super. There's nobody who is retained there. They have a very good way of social worker who follows the patient. By the time the patient walks in, even if it's 1 day or 2 days, they are already aware that this one can be able to pay or this one can be able to pay. So, ladies, and it can be done. What I want to say, people must take responsibility. It can be done.
Ladies and gentlemen, what I'm hearing a lot that is being echoed is the issue of leadership. The issue of leadership, you've also mentioned the fact that the ministry acting more like a procurement entity. What are the solutions now?
Now, quickly to respond to the chair, there is this issue of Linda Mama. The baby and the mother are mutually inclusive. You can't Linda Mama and you don't Linda Mtoto. I think it's the highest time. We should be able to extrapolate because the baby is inside the womb of the mother. Okay? So you can't separate Linda Mama and you don't come out Linda Baby. The moment the baby is born, I think we must extend with the Linda Mtoto. Because the two of them are mutually inclusive. Right. What she has mentioned about the management of the doctors. Dr. Chris, the doctors are soft skills that can be trained in management and leadership.
Let me cut you short because we have a caller.
Okay.
So we have a caller, Kembo, you're calling from Nakuru. Good morning.
Good morning to you. Habari zenu ndugu zangu.
Mzuri sana. Please table your question or your comment to the conversation we're having in studio.
Kusalamia waheshimiwa. Sasa ile mambo kuna hii kadi hizi tumekata hizi wananchi wa hapa chini. sijui hospitali zingine ni ya funoko ama ni nini. Unafika unaitishwa pesa na uko na kadi. Nataka niwauliza hawa. Kadi wanafanyia kampeni wanasema tukate NHIF tunalipa pesa zetu. Inatumika kwa hospitali yote Kenya ama ni ile tu? Kuna hospitali siwezi nikasafiri mpaka Nairobi huko nipewe dawa juu niko na hiyo kadi ya NHIF, na kuna hospitali ya serikali hapa lakini wanaikataa hiyo kadi.
Okay.
Nataka wafafanue.
All right, Kemboy, thank you for your question. I think he's referring to the fact of the matter that you have an NHIF card, but there are certain services that you do not access at every other hospital that you would want to. What is clarity? What is the clarity to that?
NHIF is very clear on the services they cover. But also what we discovered when we went to Kenyatta on Wednesday is also that the poor are being used to pay for the rich. That also, as I talk about NHIF reforms, and it's a report I'm going to table in Parliament, we find that, for example, if you want to do the kidney transplant, which is being done in Kenya, NHIF covers in a public hospital 500,000 Kenya shillings. But there's treatment that is around 300,000 that is not covered prior by NHIF. But the real transplant, they cover 500,000. After that, they do not cover for the medication. So it is work counterproductive. No, it is actually counterproductive. But you find that if then you go for kidney transplant in a private facility in Kenya, NHIF will cover between 850,000 to 1 million Kenya shillings. If you go outside, if you go to India, it will cover up to 5 million.
Regardless of the contributions?
Yes, it is the same. So we asked ourselves, are we using then NHIF for the poor to pay for the rich?
So is there a collusion between NHIF and hospitals?
It was actually what they came up with. So for the public, for NHIF has been giving more money to private facility more than the public facility. Okay. And so there are several other things that even when we go for imaging in Kenyatta National Hospital, that some patients are being, they have to wait for around 48 hours for NHIF to clear.
Okay.
So if you go to Kenyatta, you get frustrated because for you to do a CT scan or something else, you have to wait for around 48 hours for NHIF to clear you. And when you're in a private hospital, they clear immediately. So there's also a lot of collusion between the NHIF staff members and the ones who are working in private facilities. So there's a lot that we have discovered. I am only a chair for 1 year. But the reports that we're going to table in Parliament, and I want to thank the members because they have always supported us when we come up with these reports. We are thorough in what we are doing. But we must reform NHIF. As the caller said, we said it has to be very clear on what NHIF covers for everyone. Whether you're going to public or private facility, should be the same.
All right.
Whether you're being treated in Kenya or abroad, should be the same. Okay. And also, finally, we should also have that card. If I go to hospital, then I should know how much I've used in my NHIF. NHIF, we all have insurances. If you go and use your card, you are able to be told your balance is this, or now this is what is remaining. But with NHIF, you cannot tell how much you have used or not. And that is why people are lying to NHIF. They go and collude and they just sign papers and go submit to NHIF and they are paid for work that has not been done.
Kenyans have also noticed that you're having to get someone else on your NHIF card that you don't even know. So you find that, for example, for myself, I have a husband and children on my NHIF. Since when?
That's what I'm saying. There's a lot of, I don't know whether this is even corruption or daylight, robbery.
All right, we need to take a commercial break. But when we come back, we'll continue taking a look at some of the stories making headlines on the local dailies. You can call in on 0719 777. You can also text us on 22422 or tweet us at @Zinzi_K, at Citizen TV Kenya.
And at Sam Gitoku, back in a moment.